Dear students, this is our sixth lecture on medicinal chemistry, and in this sixth lecture we will discuss some basic concepts about the drugs. And out of those basic concepts, first thing is that what are essential drugs and how they are listed in different countries. Then nomenclature of drugs and some of the common adverse effects of these drugs or pharmaceutical substances which we use in our daily life. As far as drug or a pharmaceutical substance is concerned, it has many definitions. One definition is that it's a substance which is used to prevent or cure a disease or ailment or to alleviate its symptoms. In another definition, drug is called as a chemical substance that causes a change in the organism's physiology or psychology when it is consumed. Similarly, a pharmaceutical drug or a medication or medicine is a chemical substance used to treat, cure, prevent, or diagnose a disease or to promote well-being of a patient. So this is another definition of a drug. As far as the definition of the drug in pharmacology is concerned, in pharmacology, drug is treated as a chemical substance which is typically of a known structure, which when administered to a living organism produces a biological effect. So any chemical substance whose structure is known and when given to a patient or a living organism, it produces a biological effect. This is the definition as far as pharmacology is concerned. Then in another definition, the drugs, they are called as substances that change a person's mental or physical state. So these substances, they can affect the way our brain works. So this is another definition of a drug. So depending upon the circumstances, we can define a drug in different ways. Then comes the word essential drugs. What are the essential drugs? Basically, the concept of essential medicine or drugs was introduced in 1977 by WHO. And in 1977, the original WHO definition of the essential drug was that they were the medicines of utmost importance, basic, indispensable, and necessary for the healthcare needs of the population. So this was the first definition given by WHO about the essential drugs. Whereas later on, the WHO in 2002 changed its definition, and now these essential medicine, they are those that satisfy the priority healthcare needs of the population. And WHO has selected the definition of these essential drugs with regard to public health relevance, evidence on efficacy and safety, and comparative cost effectiveness. And essential drugs, they are medication, according to WHO, they are the medications to which the people should have access all the times in sufficient amounts. Further, their prices should be generally affordable. And as I've told you, that first definition of essential drugs was given in 1977, and in that very year WHO published a model list of essential medicines uh, with current list of essential medicine for adult patient contains over 400 medicines. And since 2007 there is a separate list of medicine for child patient and adult patients. Basically there are two lists. One is core list and other is called as the complementary list. The core list presents a list of minimum medicines which are needed for a basic healthcare system, listing the most efficacious, safe, and cost effective medicine for priority conditions. And further, the priority conditions are also defined. That priority conditions are selected on the basis of current and estimated future public health relevance and potential for safe and cost effective treatment. So based on these conditions, the core list is prepared. Whereas the complementary list, this presents the essential medicine for priority diseases, which specialized diagnostic and monitoring facilities are needed for these priority diseases. And this list is also important because it forms the basis for national drug policy in more than 155 countries. And these 155 countries, they belong not only to developed nations but also the developing nations. Then since the last 20 years, the countries, they are being encouraged to prepare their own list based on the local priorities for that country. And nowadays more than 150 countries, they have separately published their official essential medicine list. Then as far as India is concerned, the first ever sorry the first ever Indian National Essential Medicine List, this was published in 1996, and in 2011 Government of India announced a policy designed to increase the availability of essential medicines. The present National Essential Medicine List of India was published in 2015, and after that, uh, uh, this list in 2015 contained 376 medicines, and uh, the WHO model list of essential medicines, they are updated every 2 years by expert committee, and the current version of these WHO essential medicine list was released in September 2021, and it was 22nd essential medicine list and 8th essential medicine list for children. Now, nomenclature of drugs. Drugs can be named uh, uh, by three types of names: chemical names, generic or non-proprietary names, or trade names. So, most important names, they are chemical names, and they are based on IUPAC system. As we name organic compound, in the same way the drugs, they are named, and these names, they are called as chemical names. And the generic or non-proprietary names, they are based on international non-proprietary names which are called a INS system. These are generally derived from the property of the drug, that what kind of drug it is. Based on that they are named. Then trade names, they are basically brand names. Different companies, they have different names for the same drugs. So first is chemical names. As I've told you, chemical names, they are the scientific names, and these are based on the molecular structure of the drug. And in the chemical names, the most important is the IUPAC names, and the system of IUPAC nomenclature is same as in case of organic compounds. For example, in case of propranolol, the name is 1,1-methylethylamino. This is the carbon number 1. 1-methylethylamino. 1, this is 1-methyl, this is ethyl. 1-methylethylamino. 3, this is the longest chain, 1, 2, 3. So this is carbon number 3. 3, 1-naphthalene oxy. This is naphthalenoyl group, and this is oxy group. So 1-naphthalenoyl oxy group is attached at carbon 3 to propanol. So this is 2-propanol. So this is how IUPAC name is given for this compound. Similarly, this group can be named as isopropylamino. This group in the basic system can be called as isopropylamino, and naphthyloxy, this group can be called as a common name, it is 1-naphthyloxy propane 2-ol. So this can be named in the IUPAC system as these two names. And propranolol is its in system name, generic name, and these are some of the trade names for this drug. Amaniol, andronol, LA, provanol, propionose, etinosol, oranol. All these, they are the names given by different companies who manufacture these drugs. They give their own names, which are called as the trade names. Then generic or non-proprietary names, as I have told you, this is called as the in system. The generic name for drugs are constructed out of affixes and suffixes or stems that classify the drug into useful categories. For example, if there is some antiviral drug, the suffix will be used as vir. So from the suffix, based on generic name, we can differentiate whether the given drug is an antiviral drug, or it is an antibiotic, or it is an antibacterial. So based on that system, we can draw some information about the name of the from the name of the drug, we can draw some information that what will be the properties of these drugs. So for example, aciclovir or oseltamivir, these are again suffixes vir, so that means they belong to antiviral drug category. Then penicillin, carbanicillin, oxacillin. So here the suffix is cillin, so these are the drug class which are called as penicillin derived antibiotics. And if there is suffix ceph, then these are affix as the ceph, then cephum type antibiotics, they are there. Example is cefazolin. Then beta blocker drug class, they are having suffix as odol. So one example we have already discussed. Other are metoprolol, atenolol, all these they are termed as beta blockers. And more comprehensive list of generic non-proprietary names that can be seen at the drug information portal having this link. So these are some of the examples of nomenclature of drugs of general type of some drugs. For example, this paracetamol we use generally for fever, and this is its chemical name, this is the generic name, and this is one of the brand names. Otherwise, each company in every country will have its own brand name for paracetamol. Second is ibuprofen. This is an anti-inflammatory agent, which comes under the category of non-steroidal anti-inflammatory drugs, or generally called as NSAIDs. So this is its chemical name, this is generic name, and then there will be many brand names for ibuprofen. Similarly, all these types of compounds, they have this generic name, this is chemical name. Chemical name is generally complex because structure of drug molecules is bit larger, so that's why the IUPAC name is also larger, and generally they are the generic names they are used for different types of drugs. For example, then acetyl salicylic acid is the generic name for aspirin, and we generally use the name aspirin for these types of drugs, and IUPAC name is 2-acetoxy benzoic acid. So like this, all drugs they have three types of nomenclature: either chemical name or generic name or brand name. Then is routes of drug administration. The routes of drug administration in pharmacology and toxicology means that the method by which a drug, fluid, poison, or other substance is taken into the body. And generally, the route of administration is classified based on the location at which the substance is applied. So when application is based on location of the substance, then it may be called as oral or intravenous. Oral is when it is taken by mouth, and this when we take the medicine by mouth, it can be sublingual or it can be through buccal cavity, above our tongue, below our tongue. So sublingual or buccal. Then intravenous, we all know, when it is given through injection into a vein, then the route of drug administration is called as intravenous. Then route of drug administration can also be classified based on where the target of action is. That means it can be topical, it can be enteral, or it can be parenteral. Topical is local, that for example, if we applied it on our skin, say it is called as topical. And enteral is this has a system-wide effect, but it is delivered through the gastrointestinal tract. So this is our gastrointestinal tract. When drug is given through the gastrointestinal tract, then this is called as enteral. Then parenteral is this is a systematic action, but this is delivered by routes other than that of GI tract. So it can be given through other means other than gastrointestinal tract. Then last is adverse effects of drugs. A The WHO definition of adverse effect of a drug is a response to a drug which is noxious and unattended and which occur at doses normally used in man for the prophylaxis and diagnosis or therapy disease or for the modification of physiological function. Now, basically, why the adverse effect happens in case of any drug. What we have done is that we have fixed some normal dose of that drug, and as we know that every individual is a different individual, that means in actual the amount of dose required for each individual will be different, and that is why for some individual the normal dose may be more than the required for his body, and because of that some adverse effects they can happen. And basically what we are doing is that we are not considering the differences in pathophysiology within the individual, and because of the difference in pathophysiology within the individuals, there is a change in the way the drug behaves in different bodies in terms of pharmacokinetics and pharmacodynamics. So, and second problem is that it is difficult to distinguish between an adverse drug reaction from that of a side effect. So, side effect can also occur within or outside the normal dose of a medication, and the difference between the side effect and the adverse effect is that side effect can be beneficial also, whereas adverse effect will be only adverse drug reaction. So, for example, in case of lidocaine, when lidocaine was introduced to the patient, it was introduced as a local anesthetic. So it was used as a anesthetic agent. But later on it was found that it has an antiarrhythmic effect also. So this was used as a cardiovascular drug also. So this cardiovascular or antiarrhythmic effect is basically a side effect of the lidocaine, which is a beneficial effect. Now these are the different types of adverse drug reactions. As far as classification is concerned, it may be augmented, it may be bizarre, it may be chronic, it may be delayed, and it may be end of use, or even the adverse effect can lead to the failure of the drug. So, for example, unaffected failure of the therapy, that there is no effect by the treatment. Then it can be withdrawal reaction also, adverse effect may be withdrawal also. Then adverse effect can be time related also. Then it can be dose related, time related, and there can be a direct organ damage also, so which can lead to the chronic disease. The non-dose related and drug idiosyncrasy also. So all these types of reactions, they are because of different types of adverse drug reactions. So as I have told you that adverse effect is an undesired harmful effect resulting from a medication or other intervention such as surgery. And that adverse effect may be termed as a side effect when judged to be secondary to a main therapeutic effect. Similarly, the term complication may also be used for adverse effect, but this can be differentiated from complication can be differentiated from adverse effect uh, by the context that when negative effect is expected or common, and complication is generally result from an unsuitable and incorrect dosage of procedure, and this is called as a medical error, not as a adverse effect. So adverse effects, they are sometimes referred to as iatrogenic, related to the illness caused by medical examination of treatment, because they are generated by a physician or the treatment which the physician has given us. And some adverse effects occur only when we start the medication or increasing the medication or discontinuing the medication. So all these things. So at the start of some treatment, we may observe some adverse effect, or if we increase the dose of a drug, then also we can observe some adverse effects, or if we discontinue the treatment, then also some adverse effects they come into play. The adverse effects can also be caused by placebo treatments, in which case the adverse effects are referred to as nocebo effects. Placebo treatment is basically a harmless pill, medicine, or procedure which is prescribed more for psychological benefit to the patient rather than for physiological effect. So there will be no physiological change when we give such type of treatment, but this has been given only for the psychology of the patient, that we have given that treatment or medicine or pill. The harmful outcome in case of adverse effect is usually indicated by some results such as morbidity, mortality, then there may be alteration in body weight, or there may be some changes in level of enzymes present in the body. They may increase or they may decrease than the required values. Then there may be loss of function in some organs or some properties of the body. Then a pathological change may be detected at the microscopic or macroscopic or physiological level, that may also be seen in case of harmful outcome. And these adverse effects, they may cause a reversible or irreversible change, including an increase or decrease in the susceptibility of the individual to other chemicals or foods or procedures such as drug interactions. So these are the references used for preparing this lecture. Thank you very much.